My name is Ashley Cobb. I am an LPN to BSN student at Indiana State University in the Community Health Nursing course. This is Health Education Project number 4, and it is on electronic nicotine delivery systems. Upon completion of this presentation, you will be able to explain the risks of using electronic nicotine delivery systems, state causes of electronic nicotine delivery system related illness and death, identify ways public health is impacted by electronic nicotine delivery systems, list public health initiatives related to electronic nicotine delivery systems, and discuss improving awareness and reducing risks related to electronic nicotine delivery systems. We will stop here for a knowledge check. Please access the pretest in the link at the beginning of this YouTube video. There are various types of electronic nicotine delivery systems, or ENDS. Vapes, vaporizers, vape pens, hookah pens, e-cigarettes, e-pipes are just some of the types. These products are filled with e-liquid, or some people call it e-juice, which usually contains nicotine, flavoring, propylene glycol, vegetable glycerin, and other ingredients. The device heats the liquid, which creates an aerosol, which is inhaled by the user. Many people may believe that these are safer than smoking tobacco products, but there are no safe tobacco products, including electronic nicotine delivery systems. Along with tobacco-related disease and death, there are other public health concerns related to ENDS, such as overheating, fires and explosions, lung injuries and seizures, and other neurological symptoms. One of the main causes of illness and death is what is called e-valley, or e-cigarette or vaping use-associated lung injury. It's a severe lung injury which is tied to the vitamin E acetate additive, which is mostly found in e-cigarettes containing THC, which is the chemical responsible for most of marijuana's psychological effects, or what gives you the feeling of being high. Symptoms include shortness of breath, fever and chills, cough, vomiting, diarrhea, headache, dizziness, rapid heart rate, and chest pain. It's diagnosed by chest x-ray or CT scan, which is looking for hazy spots or opacities on the lungs, which indicate tissue damage. There's still research being conducted to determine best treatment course for E-valley, but about 96 of the patients that presented to the emergency room required hospitalization, and some even died. Treatment is primarily based on symptom control, antibiotics to treat infection, and corticosteroids to reduce inflammation. If blood oxygenation is affected, they may need supplemental oxygen or even mechanical ventilator. Most electronic nicotine delivery systems contain nicotine. Nicotine causes a person to crave a smoke and suffer withdrawal symptoms if they ignore the craving. It also raises blood pressure and spikes a person's adrenaline, which also increases their heart rate and their risk for heart attack. Studies have shown that nicotine can be just as addictive as heroin or cocaine. It has negative effects such as slowing brain development in teens, which impacts memory, concentration, learning, self-control, attention, and mood. Additionally, nicotine is considered a gateway drug, which increases the risk of addiction to other substances later in life. Also, batteries in these devices are known to overheat and explode and have caused fires. And there have been reports of seizures or convulsions, mostly in young adults and youth, related to nicotine toxicity. Vaping is making people sick and even leading to death, which is what makes this a public health concern. It's a habit that's trapping many young people into a cycle of addiction. It appears on the surface to be a quote-unquote cleaner way to take in nicotine, yet it has health risks that are both known and unknown. As a result, vaping is a clear public health risk. As of early 2020, at least 68 people had died and another 2,800 had been hospitalized due to vaping-related illness or injury. About 66% of those patients were male and median age 24. Amongst those who had died from those illnesses, the median age was 51. Sort of alarming is that 2.55 million high school and middle school students reported using tobacco-related products, and they indicated that they perceived little to no harm in vaping. Long-term effects of vaping are still mostly unknown because they're relatively new, and because of this, there haven't been enough studies to determine whether there's long-term effects from a cardiovascular or pulmonary standpoint, or if they cause cancer. Electronic nicotine delivery systems in the news. So there have been reports of deaths in teenagers, not just this one, but in this particular story. 17-year-old from the Bronx in New York died at Montefiore Hospital from a vaping-related pulmonary illness. There's a quote from that news story which states, "Parents have to know, young people have to know you are playing with your life when you are playing with this stuff. It's not just best case scenario for vaping. You get addicted to nicotine and that is a lifelong struggle. I can tell you as a person who is young and stupid and smoked, it's an addiction that will fight for your entire life. That's best case. Worst case is you vape and it kills you. It's not regulated, it's not tested, you don't know what vaping is. Nobody studied the effects of steam in your lungs with these chemicals and you drop dead." So how can we improve awareness of the risks and of electronic nicotine delivery system use and reduce risk for illness and death? People need to know that vaping may be less harmful than smoking, but it's still not safe. It still exposes you to toxins, although fewer than smoking. There have been an outbreak of lung injuries and deaths associated with vaping. Research suggests vaping is bad for your heart and lungs. It's toxic. It raises your blood pressure, spikes your adrenaline, and increases your risk of likelihood of suffering a heart attack. E-cigarettes are just as addictive as traditional ones. Users can buy extra strength cartridges which either contain more nicotine or increase the voltage, which gives you a greater hit of nicotine. They are not the best smoking cessation tool. A recent study found that most people who used e-cigarettes with the intention of quitting smoking still continue to use those along with traditional cigarettes. Most alarming is that a new generation is getting hooked on nicotine. Many teens believe vaping is less harmful than smoking, and that it costs less, so they use these as it's more appealing than smoking cigarettes, and they do not have the odor associated with the stigma of smoking. The CDC has some recommendations for the public. Stop using e-cigarettes. Do not alter them or buy them on the streets. Avoid use in the young or pregnant. If you have symptoms such as a cough, shortness of breath, or chest pain, you should seek medical attention. If you're trying to quit smoking, you should use FDA-approved medications and counseling rather than using a vape. If you're concerned about harmful effects or toxicity, you should call poison control. And if you have any unexpected health or product issues related to e-cigarettes, they urge you to notify the FDA. Here are some public health initiatives related to electronic nicotine delivery systems. The FDA has the Real Cost campaign, which is a program to educate youth about the dangers of e-cigarettes. It addresses the cost-free mentality in middle school and high schoolers with messages that educate them that e-cigarettes are putting them at risk for addiction and other health consequences. Community in Crisis has a program. Website has resources for prevention and early action, toolkits and resources, recovery support programs, and workshops and training. The CDC has multiple fact sheets, handouts, and education about electronic nicotine delivery systems. Many states, including Washington, have changed their laws or legislature to include restrictions on e-cigarettes. Chapter 70.345 in Washington establishes important youth access protections to reduce illegal youth access, provides penalties for those who do not comply with those requirements, regulates internet and distribution markets, and provides common sense consumer protections such as warning and nicotine content disclosures. Establishes fines and fees for vapor products to pay for enforcement and prevention. This is the first increase in fees and fines in 23 years. We'll stop here to take the post-test to assess your knowledge about electronic nicotine delivery systems. The FDA has many great resources available for education and awareness on electronic nicotine delivery systems. There'll be a flyer in the link at the beginning of this video with important links.